Tanzania, East Africa country, straight just south of the equator. Tanzania was formed as a sovereign state in 1964 through the union of separate states of Tanganyika and Zanzibar. Mainland Tanzania cover more than 99% of the combined territory's total area. Dodoma, since 1974, the designated official capital city of Tanzania, is centrally located on the mainland. Dar es Salaam is the largest city and the port in the country. Tanzania is home of the second tallest mountain in the world and the first in Africa, Kilimanjaro, and a number of UNESCO-recognized game reserves like Ngorongoro crater in the Serengeti National Park, with a population of about 65 million people according to 2022 national census, being the populous country in East Africa. The country president of Tanzania is Dr. Samia Suluhu Hassan. Medical practices in Tanzania have shown remarkable improvement over recent years. As of 2018, the country had a significant number of medical professionals working in health facilities, with over 96,000 individuals employed in the sector. This included around 20 and 800,000 enrolled nurses, 2 and 600,000 medical doctors, 739 medical specialists, and about 3,000 assistant medical officers serving the population. Normally, the doctor basic salary is between 625 to 1,042 US dollars for general practitioner specialists, respectively. As per 2022, Tanzania had a total of 8,497 healthcare facilities in the country, of which 62% are public. As per 2022, there are 337 hospitals listed by the Ministry of Health. Among the regions, Dar es Salaam, the capital city, had the largest concentration of hospitals, 53 facilities. Mwanza and Kilimanjaro regions followed, each with 21 and 20 hospitals, respectively. The healthcare system is arranged in a hierarchical structure, where the first line health facility is a dispensary to be built in every village and health centers to be built in every ward, as it is written in the Primary Health Care Development Program of 2007 to 2017. High up in the rank is a district hospital, regional referral hospitals, zonal referral hospitals, and a national hospital. Recently, all regional referral hospitals were supplied with CT scans. There are some specialized hospitals like Ocean Road Cancer Institute and Milembe Psychiatric Hospital. The National Hospital also runs specialized institutes called Jakaya Kikwete Cardiac Institute and the Muhimbili Orthopedic Institute. Healthcare services in Tanzania are overseen by the Ministry of Health and include both public and private hospitals. The medical store department ensures the availability of essential medications and medical equipment in the hospital. Healthcare costs are covered either personally or through the government National Health Insurance Fund and other private and subsequent health funds. In summary, Tanzania's care system has made significant advancement with a low-cost medical education program and effective healthcare service provision through the cooperation between the government and the private institutions. The commitment of training competent medical professionals and ensuring access to essential healthcare services underscores the country's dedication to improving healthcare outcomes for its population. With more than 10 medical scholars, medical education in Tanzania focuses on a Doctor of Medicine program, a 5 years, 10-semester competency-based course. This program emphasizes core subjects requiring students to pass all courses without the option for electives. The initial 2 years concentrate on basic medical science, clinical medicine, introduction, fieldwork, and community training. The subsequent 3 years focus on practical aspects including junior and senior clerkship, community health training, seminars, lectures, and the practical sessions. The total fee for the 5 years study period ranges from 3,750 to $12,500 for public and private universities respectively, with accommodations expenses approximated $8,750 per year. Following the completion of the program, an intern year is required, during which the intern doctor gain practical experience in different specialties like internal medicine, surgery, pediatrics, psychiatry, emergency medicine, obstetric, and gynecology. Subsequently, a doctor must pass both pre-intern and post-intern examination administered by Medical Council of Tanzania to become licensed as a general practitioner. Further specialization requires additional study ranging from 3 to 5 years, depending on the chosen field. When talking of overall public health concern, Tanzania has a population of 18.8 million women aged 15 years and older who are at risk of developing cervical cancer. Current estimates indicate that every year, 10,241 women are diagnosed with cervical cancer, of which 6,525 die from the disease. Adult HIV prevalence in Tanzania is estimated at 4.5% according to the United Nations AIDS program in 2021. With the region HIV prevalence ranging from 0.5% in Zanzibar to 11.4% in Njombe, a region in southern island of Tanzania. Mother and child death is of big concern in the country, with the maternal death being reduced 44% between 1990 to 2015. More recently, special maternal and neonatal program like a MAMA established by the President of Tanzania aims to attain more success in reducing both maternal and early neonatal death rate. A typical day in the life of a medical doctor in Tanzania begins with morning meetings, usually starting at 8 a.m. at the hospital between the doctors who work in the night shift, nurses, interns, registrars, residents, and consultants. During this meeting, they discuss a number of night admissions, serious medical cases, lab investigations, and the management given. Medical students may also participate answering questions from senior doctors and consultants to enhance their knowledge. Occasionally, continuous medical education sessions are conducted for clinical staffs and students. At the meeting, doctors review the lab and radiological results for their patients, handle administrative tasks, and prepare for the ward round, usually starting between 9 and 10 a.m. During the ward rounds, doctors physically examine patients of all ages and conditions, diagnose illnesses, prescribe medications, discuss treatment with consultants, and refer severe cases to tertiary hospitals. They also conduct wound dressing and may quiz students and residents to assess their understanding. Watch this.
Who fed this child?
I fed the child
by using which route?
IV, Chief. IV.
IV?
Following the ward round, some doctors attend to patients in the outpatient clinic, where they diagnose, perform physical exams, and admit some patients to their respective wards. Minor procedures like foreign body removal, ear wax extraction, cast applications, and chronic wound care may take place in the minor theater and emergency department during this time. Doctors in Tanzania work long hours, typically 8 hours. That's equivalent to 40 to 56 hours a week, which is including night shift, weekend, and the public holidays. Throughout the day, doctors must be prepared for unexpected situations, such as nurses calling for immediate life-saving procedures like cardiopulmonary resuscitations. The workload is demanding, requiring medical professionals to juggle clinical duties, education, administrative tasks, and emergency responses in a fast-paced hospital environment. Medical consultants offer specialized services such as advanced surgical procedures and the learning specialist clinic based on their expertise. Doctors usually have lunch between 1 to 2 p.m. in the afternoon. They continue their work in the ward, managing patient care, ensuring stability, filling in medical reports, and communicating updates with patient families. They may also assist in preparing the patient for surgeries, attending surgical procedures, following up diagnostic report like blood test and imaging results. At the end of the day, they compile the patient handover list for the night shift team before going home.